My fellow Iowans, in February, Iowa's unemployment rate climbed to 4.8%. While Congress and the Obama administration work to develop a strategy for long-term economic stability and growth, taxpayers are in need of immediate relief, particularly with the cost of health care coverage. COBRA was enacted in 1985 to help workers who lose their jobs continue their health insurance. Under COBRA, ex-employees are allowed to maintain their health insurance, but are required to pay the entire premium. Since COBRA premiums average more than $1,000 a month, this represents a significant burden to many Iowans. That's why I'd like to take this opportunity to explain an important part of the American Recovery and Reinvestment Act, the COBRA subsidy. The COBRA provision of the recovery package is intended to help recently laid-off workers pay for COBRA coverage, providing a critical financial bridge to those hurt by the recession. The bill provides a 65% subsidy for COBRA continuation premiums for up to 9 months for involuntarily terminated workers and their families. The subsidy applies only to COBRA payments made after February the 17th, 2009, the date the recovery package became law. The House Joint Committee on Taxation estimates that the provision will help 7 million people nationwide to maintain their health insurance. To ensure that COBRA aid gets to those who truly need it, eligibility is based on your 2009 income, $125,000 or less for an individual and $250,000 for families. Also, if you lost your job between September the 1st, 2008 and February 17th, 2009, but you decided not to enroll in COBRA because you could not afford it, you have an extra 60 days to sign up and receive the subsidy. You lose eligibility, however, if you are given health care by a new employer or are eligible for Medicare. Finally, certain small businesses are not subject to COBRA, so if your previous employer is in that category, but you are eligible for state continuation, you can still receive the 65% subsidy. Although nearly 1/6 of Americans are uninsured, the United States spends millions more on health care than other industrialized nations that provide universal coverage. There is broad consensus that one of the greatest problems facing us today is the skyrocketing cost of health care. While we do not all agree on the best course to follow, we can see eye to eye in many ways. We know we need a plan that works for families and businesses and one that stresses the affordability and preventive care. We need a plan that also allows patients to make good decisions with their doctors. As the discussion on health care reform advances, my colleagues and I in the 111th Congress plan to craft bipartisan legislation to achieve all those goals and bolster our economy for generations to come. But the road to recovery is long. In the meantime, the citizens of Iowa's 3rd District have pressing concerns. If you think you are eligible for the COBRA subsidy, you should contact your previous employer as soon as possible. If you need an additional help, please feel free to contact me at the Des Moines office at 515-282-1909 or toll free at 1-888-432-1984. You can also contact me in Washington, D.C. at 202-225-3806. We'll work together.